Good evening. My DNP project is on transitional care. This presentation focuses on transitional care with a particular emphasis on patients being discharged from my hospital. Currently, the hospital's HCAP scores for transitional care are below the intended goal of 60%. This situation can negatively impact patient safety, patient satisfaction, hospital admission rates, and reimbursement. Addressing this problem requires closing the gap by championing evidence-based intervention. The need for improvement in transitional care is evident, as it is essential to enhance the HCAP scores to maintain a satisfactory hospital rating. Although practices are being implemented, the level of unpreparedness remains below standard. Clarity on quality care initiatives and follow-up protocols require a standardized mechanism for developing discharge plans. Some of the plans that are in place currently at the institution are early recognition of care partners, and this is done at admission. We involve care partners in the care plan, and prior to discharge, there is care partner meeting, especially for those people who have difficult discharges. There's existing leadership rounding, there's interdisciplinary rounding, and also the implementation of volunteers to make follow-up phone calls to patients when they're discharged. The proposed policy and change initiative, as I researched, the ideal discharge protocol seems like a protocol that could be implemented at this institution to improve their score. The gap analysis. Some patients are discharged without a proper understanding of the type and quality of their care plan. This is more readily apparent in patients with multiple comorbidities. The result can be relatively low scores, problems with self-care, increased readmission rates, and financial consequences for the institution. Current situation is poor understanding among patients of the discharge plan and low HCAP scores. Gap in inconsistencies in discharge education and follow-up care. The desirable outcomes is to improve the HCAP scores so that it's greater than 60%. And the effect of not doing anything is increased cases of patient being readmitted, financial penalties, and declining trust level. The SWOT analysis. The major strengths that was discovered include teamwork, leadership support. However, the organization has weaknesses, and these include inconsistencies in patient education on discharge care and structured methods of follow-up phone calls after discharge. The opportunities for improvement include boosting satisfaction score, and this helped to reduce readmission rate. The primary threats that could occur include staff resistance, a lack of stakeholder buy-in, insufficient funding, and inadequate time. The proposed intervention. The ideal discharge protocol provides an evidence-based approach essential in improving success in addressing the challenge of transitional care. Priority is to identify the existing problem, focus on improving patient satisfaction by addressing challenges such as the risk of readmission. The process must be inclusive, educative, based on proper assessment, especially using the teach-back method and listening to the patient. The ideal protocol, discharge protocol, can be broken down with the I stand for engagement. I stand for including the patient and family in their care and what to expect after discharge. The D, you discuss medication, lab results, warning signs and side effects of medication, and follow-up strategies. For E, you educate the patient and you use plain language that they can understand. A is for assess, and you use the teach back method to find out if they understand what was taught. And listen, you listen to the patient and help them to accomplish their goals. The conclusion: Putnam Hospital is currently facing challenges when providing transitional care. There is an urgent need to improve to provide evidence-based solutions that can ensure the sustainability of operations. The ideal discharge protocol provides a systematic way of creating an inclusive environment. For DNP nurses leading such a change initiative, the main focus is on enhancing performance, reducing readmission, and improving patient outcomes. Thank you.